It may seem just like summer started, but time is already running out to get your teen fully vaccinated by the new school year. Here to talk more about this is Dr. Melanie Mouzoon with Kelsey-Seybold Clinic. Welcome to Houston's Morning Show.
Good to see you again.
Well, you as well. So let's talk about what's going on with this right now. If you just think about it, I mean, we're already, well, half through summer. I can't believe it's happening so fast. If parents want their kiddos to be fully vaccinated before school starts, at least those teenagers, anybody above 12, do they need to really start that process right now if they haven't already?
Absolutely. Not only for the COVID vaccine, but for routine vaccinations. So the COVID vaccine for teenagers, of course, is 21 days, 2 doses 21 days apart. So you need to also remember that it takes 2 weeks after the second dose to be fully protected. And so we really have about a month and a half span before school starts in order to get our children vaccinated and protected by the time the school year starts for the COVID vaccine. Plus, many children are way behind on their other shots, not just teenagers, but little kids. And some of the vaccines that teenagers routinely get are 2 doses 6 months apart for cancer protection. And they also need vaccinations for whooping cough and for meningitis as well. So there are lots of kids who have gotten behind on their routine vaccinations and also need to get the COVID vaccine.
All right, so let's go back to that COVID vaccine for parents who aren't used to this and aren't really sure what to do, because before they were used to seeing all the vaccination sites everywhere that you would just pull up. Let's talk about those steps and the process of actually getting them vaccinated. How would they go about that, first of all?
So some of those big vaccination sites are still open, and many others, it's very easy to call and get an appointment. So at Kelsey-Seybold, for example, you can call and get a same-day appointment for vaccination for your teenagers at least 5 of our sites. And we're working on getting those vaccines available just in the doctor's offices as well. So you don't need to plan too far ahead. You just need to get in your car and make a phone call and go. If your teenager is going to go by themselves, they'll need some sort of a permission slip from a parent, but it's best actually to go along with them. Teenagers do sometimes faint or don't want to wait around for the 15 minutes after the vaccine, and it's good to have a parent available to make sure that all the permission slips are signed and everything is done appropriately. We do make some exceptions, you know, if a parent can't come and the teen is driving themselves, for example, with written documentation that the parent agrees with the vaccine.
That is good to know. Talk to us about what you're hearing from parents. There's still a lot of concern about getting their kids vaccinated, or has enough time passed where they're really watching what's happening with other kids and feeling more comfortable with it? Or on the other hand, are they concerned about some kids who've shown up with heart inflammation and they might be concerned it might happen to their child?
So what's interesting is that early on, there were a lot of people eager to get their children vaccinated, and there were long lines once children were able to get the vaccine. Now we're in a bit of a slump where people are a little more cautious and hesitant about getting the vaccine. I think we need to understand that all vaccines make people a little hesitant. Nobody likes getting jabbed in the arm, and this vaccine has gotten a lot of press about side effects. The truth is, the side effects of getting COVID infection in childhood are much more serious than the side effects of the vaccine. And even the heart inflammation, while it sounds very serious, has been mild in those who've gotten it and resolved in a few days.
Well, thank you for clarifying that. It's really good for our viewers to know. Now let's talk about some new guidance from the World Health Organization urging fully vaccinated people to wear a mask because of this Delta variant that is supposedly so much more contagious than what we've seen. What are your thoughts about that? Are you suggesting to your patients that they consider wearing a mask again? I think we've all gotten kind of lackadaisical about it and can't imagine going back to that full time, but here we go again, do you feel like?
So the World Health Organization has to consider the situation in all countries, and some of the vaccines are much less effective than the vaccines we've been using in the U.S. Even those, for example, who've gotten AstraZeneca or the Janssen vaccine, which are effective vaccines, those two vaccines seem to be a little less effective against the Delta variant, and the Sinovac and some of the other vaccines used across the world are much less effective against the Delta variant. So to some degree, it depends on what vaccine you got. The Pfizer and Moderna vaccines seem to be really pretty good protection against the Delta variant. But if you got a different vaccine, you may want to mask up again, particularly if you're in large crowds or the grocery store, someplace where you don't really have any control over who's around you, and it's an enclosed space. If you're in an outdoor situation, it's not as necessary. And I think there is a little bit of fear about this variant that's being spread around, but there are also people who got good vaccines like the Pfizer and Moderna and still do not have great protection because of their own immune system not working very well. So those people definitely ought to continue to wear their masks.
Better safe than sorry, it sounds like. Dr. Mouzoon, thank you for all your time from Kelsey-Seybold Clinic this morning. Valuable information to walk us through.
My pleasure.